Hi, and welcome to this training video. So this video is on my very favorite topic of all time, which is brand management. So as I mentioned in that one of the first videos I put up about setting the scenes, so brand management or your brand plays a really important role in sort of that foundation work, because deciding who you are as a brand and what you want your brand to be and what you want people to think and feel about you plays a really important role in then deciding what marketing activities should be included in your marketing plan, and also plays an important role in developing things like your tagline and key messages and your colors and all that sort of stuff. So I put some slides together just to talk you through sort of the key elements of effective brand management. And there's also a couple of tasks in there as well, particularly around thinking about what brand associations that you want. So what are the things that you want people or your prospective and current patients to think and feel about you? And so once you put some thought into that, you can then add that or fill in that section of the marketing foundations template. So what do we mean by brand? So when someone is asked what we mean by a brand, most of the time people will say, well, it's your logo and it's your colors and your look and feel. And that's definitely correct. Those things definitely play a really important part. But a brand is really so much more. It is in essence everything that someone thinks and feels about you. So all the things that a prospective or current patient thinks or feels about you, in marketing, we call those things brand associations. Your brand also needs to be strongly aligned and support and enhance your story, vision, and mission. And it also relates strongly to your position in the market. So what do we mean by position in the market? So when we talk about markets in marketing, it's really that area that you work in and compete in. So normally as a health practitioner, it will be a geographical area where patients will come from within that geographical area to see you as their health practitioner. So when thinking about your position, so there's lots of obviously health practitioners doing focusing on the same area of health, but they will focus on that area of health differently. So that might mean that they do different treatments in that area of health, or it might mean that they look after a different group of patients. So as a psychologist, your position might be to look after adults with depression, or it might be to look after adolescents with anxiety. As a private health practitioner, your position is obviously to help the private patient groups versus other practitioners that are working in the public space or bulk billing space. So thinking about your position assists you in defining your patient and referrer types and your fees and your look and feel, because once you know what position you want, then it assists you in thinking about what patient groups are going to suit that position, what your fees might be. So if your position is the leading cardiologist in New York and you're going after private patients offering the most exclusive high-level service, then you will probably think about your fees that are probably more expensive than someone who is doing similar treatment, but very stock standard types of treatment, maybe doing some public work on the side as well. So it really helps you own your own space in your field and become the well-known expert in it. So your task. So using the marketing plan template, write down the position in your market that you would like to own. Okay, brand associations. So brand associations, as I said, it's everything that someone thinks and feels about you. And brand associations can be created from every single touch point that a prospective or current patient might come across in their journey, where they're finding out about you, to walking into your practice, to having their first appointment, to undergoing some treatment. And it can happen from when they look on your website, reading your brochure, what a friend said about you, how your practice manager spoke to them, what your waiting room looks like, their experience of their first appointment with you, and their treatment experience and outcome. And so there's been a lot of research in brand associations, and the research clearly shows that the more positive and consistent associations, the more a patient or prospective patient will have confidence that they have made the right decision. So if a patient, no matter what touch point they come across, everything that they experience is positive and there's consistency. So by inconsistency, I mean, so your website tells them that you are a really professional, highly qualified, highly experienced health practitioner. And then they call your rooms and the practice manager is really rude to them. Suddenly there's a conflicting association, because on one hand they've created really positive associations, on the other it's negative, and that negative association then plays a role in their overall view and perception of you as a health practitioner. So all these little touch points play a really, really important role, and it can be useful to do things like a touch point journey audit. So you're mapping out each step that a prospective patient might take on their way to seeing you as their health practitioner, right through to the treatments that they might undertake, right through to an outcome or the last time that they'll see you, and just make sure that all those touch points are delivering the messages that you want them to deliver, that they're going to be positive experiences, so they will overall build your credibility as a health practitioner. So as I said, inconsistent and negative associations and associations that people perceive to not be aligned with your vision cause confusion and erode your brand credibility and create doubt around the decision they made to see you. So some brand association examples. So some of the things that you want a prospective patient to be thinking about is they want a thought that, oh, he's one of the leading health practitioners or doctors in this, or she genuinely seems to care about me and is doing everything she can to increase my chance of a positive outcome. Now, he really listened to my son when he explained what was going on in his life. So prospective patients will create brand associations about you, whether you do anything or not. So the idea with marketing is to try and control those associations as much as possible. And a lot of those things we can control. We can control what's on your website or what's posted on your social media. You can control what your staff say with some training. You can control the experience that you give them in an appointment, and even making sure that their experience throughout treatment, even if the outcome isn't good, you want them to look at that experience in a positive way. So using the marketing plan template, have a think about the top 5 brand associations that you would like a prospective patient or current patient to have about you. Obviously, you can have a lot more, and people do have a lot more, especially the more time they spend with you as a patient. And then once you've created those 5 brand associations, then the idea is to make sure you're always going back to them and thinking about all those touch points, your website, your brochure, your waiting room. Do all those touch points, are they all going to help you create those brand associations that you've written down? So colors, language, look and feel. So these things really support and enhance your brand and really need to be an extension of who you are as a health practitioner. And they should also align with your area of health and patient group. So obviously, if you're looking after children, then your colors and the look and feel of your waiting room will be different than if you're treating women going through fertility. So when I talk about language, I mean the language that you use in normally your written words, so that whether that's in an email or whether that's on your website or social media, and also needs to be an extension of who you are. So one practitioner I work with, he's lovely and very friendly and approachable, but he's also quite formal. So when he talks to patients or writes to patients, he'll be dear X, all the best, yours sincerely. So even on social media, when I'm managing that for him, I need to think about that I am writing in his voice. So if he typically says dear patient, then I'm going to write dear patient on a Facebook message if someone writes a message and I'm responding to them. Because if I start using different language or language that I would typically use that isn't in his voice, then that patient is probably going to have experienced his voice when they've seen him or through an email from him, and then they'll be getting a conflicting message because the language that they're receiving in different platforms is different. So just have a think about the language that you want to use and the look and feel that you want to have. And basically it's just keeping things true to who you are. And this gets more important once you start having more staff working for you, because they need to make sure that they are using your voice when they communicate to patients, particularly through things like social media and the website.